Hello, I'm Robert McMullen. I'm a psychiatrist, and I've been treating patients mainly with psychopharmacology for over 30 years, and I wanted to just answer the question whether psychiatrists help depression very much and how they do it. There's a long history of research of using antidepressants for depression, and they work. And generally, any antidepressant you use, if you get it up to a good level, about 60% of people are going to improve at least 50% in 6 weeks. And maybe 15% are going to come all the way to normal. Instead of just halfway up, they'll come all the way to normal. And then if you keep going and add a different antidepressant, or add a little thyroid hormone, or add a tiny amount of lithium, and there's all sorts of other things and nutritional things that you could add to augment and induce the patient's depression to go away completely. And that's what we do. And with many people, we keep trying thing after thing and combination after combination until we find something. Now, there's a lot of people who poop out on antidepressants. They get benefit and they're feeling great for 2 years or even 15 years, and then it just stops working. Or it may only work for a month or two and it stops. We're not entirely clear about this, about why this happens, but many of these people are actually slightly bipolar. They're not manic depressive, because you would know it if you'd had a manic episode. You'd have ended up in a hospital or something. But they are perhaps prone to mild highs where they get into a new hobby or a new interest or a project, and they get really excited for a few hours or a few days, and are working harder than usual and focusing really well, and putting everything else aside and sleeping only 7 hours instead of 8 hours, but still having a lot of energy. That's sort of like a mild high. And people can also be a little bit bipolar who never have any euphoria, never have any mild highs, but just have a lot of mood swings, sometimes with agitation and increased anger and sudden swings in moods. And those people are more likely to poop out on antidepressants, and then you should use different medicines. We call them mood stabilizers, but they're really antidepressants. They really help stop depression. They don't just stop highs. They're better at helping the depression. And those are Depakote or divalproate, and lithium, and often in very low doses of lithium, and Lamictal, which is lamotrigine, and there's one other one called Tegretol or carbamazepine. And then if after 2 or 3 trials of medicines the response is not very good, then you should move on and do something like TMS. Now there's also some other electrical treatments where it's called TDCS. T, capital D, capital C, capital S. Transcranial direct current stimulation, where you run a little electricity from the shoulder, say, to the forehead. And these devices have been shown to help depression, and I've used them on dozens of people. But the rate of getting people better is just not that high. And it's a lot of trouble, and it's amazingly difficult to get people to do this for a half an hour every day. What's more effective is transcranial magnetic stimulation, which is a huge magnet going on and off suddenly. You're running a lot of electricity through some copper coils, and that makes a very powerful magnetic field. And a magnetic field doesn't really do anything to your brain if it's just static, but it's the fact that it goes on and off. And the magnetic field penetrates the skull perfectly easily. And that's the beauty of it. So you can do something to the brain that's relatively gentle And the only discomfort is if it causes your scalp muscles to tighten up a little bit, so we go a little slowly. And we have various ways of treating depression. Either the usual two are either an excitatory treatment on the left dorsolateral prefrontal cortex or a quieter inhibitory treatment on the right. And there are new parameters, new ways of using TMS that have come up. And there's two types of TMS machines. The BrainCare machine is allegedly the best, and I think it may be a little better than other machines, but they all work well. And the BrainCare machine is a helmet, and the coils are configured by a physicist in such a way that the magnetic field goes deeper, and that seems to make it more effective. The other types of coils are the ones that have been used the most, and they're called figure-8 coils, and they look like Mickey Mouse ears that they have a copper coil inside each circle, and then the magnetic field meets where the two circles meet, and then that's where this magnet is strongest, and that's how you use it. And the TMS, usually you need 20 to 40 treatments to get a good benefit, and maybe half of people will come to a completely normal mood in 30 treatments. And then if you relapse, it's got a long-acting benefit, so if you relapse 2 months later or 2 years later, usually you only need a few treatments to be back up to normal.
Thank you, doctor.